Hello, everyone, and thank you so much for joining episode 1 of A Renewed Hope for Health. I'm Heather Flannery. I'm your host. I'm the co-founder and chief executive officer at AI MINDSystems Foundation. And today I am joined by 3 esteemed panelists that are going to be unpacking the sweeping implications for health transformation that we are working on together with our partners and allies. Just from a housekeeping perspective, you are on listen-only mode automatically. Please do capture your questions in the Q&A dialog box, and we will be making our best effort to address them during that section toward the end of the event. So with that, I'd like to start by introducing our esteemed panelists. I'd like to begin with my co-founder and our Chief Scientific Officer, Dr. Sean Mannion.
Hello, I'm Sean Mannion. I'm a neuroscientist by training, and I spent 18 years in support of the military health system as a contractor and federal civilian. Around 2016, I saw the Health and Human Services white paper contest for what blockchain could do for health and life sciences, and decided that it really was something that we wanted to start exploring, though I didn't think it would cut and paste from other industries the way some people had hoped. And so since then, we've been working, Heather, myself, and a large number of others to apply emerging technologies, not just cut and paste in healthcare and life sciences, but in a way that can both align with and improve health outcomes in the health and life sciences. So very happy to be here today and looking forward to the discussion.
Thank you so much, Sean. And next to my esteemed co-founder and our Chief Veterans Health Officer, Dr. Hassan Tetta. Over to you.
Thank you, Heather, and it's a pleasure to be here and joined by such an august company. My name is Hassan Tetta. I'm a physician, thoracic surgeon by training, board certified in clinical informatics, and had the honor and privilege of serving in the United States Navy for 25 years, retiring in 2023. During my time of service, in addition to being a surgeon and deploying as a combat surgeon to various places all over the world, I had the distinct pleasure and honor and privilege of serving as the Chief Medical Informatics Officer for the United States Navy. That role led to many opportunities, including being recruited to the Joint Artificial Intelligence Center, where I served the last few years of my career at the Pentagon. The organization has been reorganized to the Chief Data AI Office, but in that role and in that capacity, my team and I, along with a tremendous support from a cadre of individuals throughout the department, instituted, implemented, scaled, and deployed AI solutions across the enterprise that to this day are in use. That experience was tremendous. It led me to leave the military and bridge that time with several other enterprises, including joining the group here at AI MINDSystems Foundation to lead a National Hero Initiative, which stands for Health Enhancing Resource Orchestration, with the aim of identifying AI solutions and helping to build the infrastructure that's necessary to provide first responders, veterans, and military personnel and their families the resources and care that they need in the sea of plenty while leveraging AI technologies to do so. So it's a pleasure to be here, honored to be a part of the group, and looking forward to the discussion.
Thank you so much, Hassan. And now I have late breaking news. Our newest colleague and team member here at AI MINDSystems Foundation has joined us today. Please allow me to introduce and welcome Ryan Wright, our new Vice President of Medical Asset Tokenization. Over to you, Ryan.
Hello, hi. My name's Ryan Wright, Vice President of Medical Asset Tokenization, like Heather said. I've been in the medical industries in several capacities since 2005. And that in my latest stint has been in radiology for the last 10 years. And about 6 years ago, I ran into some very interesting people who got me on the path of blockchain and healthcare. Never thought of putting the two together. And that has led to working with several companies in the field and starting one myself for actually digitizing medical records. And I'm very excited about bringing that to AI MINDSystems and helping establish protocols and future initiatives for how participants in our programs can be true stewards of their healthcare in a greater degree than they are now. And it helps all stakeholders, I believe, in every part of what we do. And I'm excited to make sure that everyone's healthcare data is accessible to them, that their healthcare decisions are of paramount importance to them, first of all, and that their decisions are more easily expedited because the information is more easily available. So I look forward to future conversations, and thank you, Heather, for including me today. And nice to meet everybody.
Thrilled to have you. Nothing like out of the frying pan into the fire, right?
Yeah.
That's it's great that you're here. So I want to kick off this discussion double clicking on the National Hero Initiative and the kinds of impacts that Dr. Teta was mentioning that we will be seeking to bring about for the National Hero cohort. That cohort includes veterans. It also includes first responders. We hope active duty service members, and importantly, all of their immediate families. And I'd like to, if we could start, Dr. Mannion, you are the very earliest originator of this initiative. And I'd love if you could give some of the backstory. And I know it exceeds prior to AI MINDSystems Foundation and our shared work over many past years, the thought work that has led up to the National Hero Initiative. And I'm particularly thinking of Colonel David Sutherland's Sea of Goodwill as an important point. Over to you.
Certainly, and I was introduced to Colonel David Sutherland, who is the founder of Dixon Center for Military and Veteran Services. Back when he was still in uniform and in the Army and appointed to the Joint Chiefs of Staff for warfighter wellness. And he came to visit us at Defense and Veterans Brain Injury Center, where I was working as a federal civilian at the time, and outlined a really beautiful vision of a solution to an existing problem that maybe shouldn't be a problem, but that is. And what he described as the Sea of Goodwill, where a lot of up to 30,000 or more nonprofits focused on military and veterans, a nation and leaders that were obviously in support of helping military and service members and veterans. And yet all of this help wasn't reaching the people in need oftentimes. And so he described it as matching resources to need. And he set up Dixon Center to do just that. And with that in mind, I had stayed in touch with him. So when Heather and I were starting a previous concern and looking at how these technologies could be brought to bear for health and life sciences, on day one, we met with him and some of his colleagues in order to outline how some technologies could help bring that resource to need. And it was really there that we, had the early makings of what is now the National Hero program. It's been a long time putting all of the human pieces together as well as the organizational and idea pieces together so that the tech can be applied to the problems where they are and create new solutions rather than just new pockets of non-solutions. So it's a little prehistory on that.
Thank you. And Dr. Teta, one of the characteristics of the National Hero Initiative that's really groundbreaking is that it is going to orchestrate resources, match resources to need around individual veterans, but not only from the VA, not only from community care sites, also from social safety net programs in the public sector, and critically from philanthropic resources, such as Dr. Mannion mentioned, 30,000 nonprofits in the United States seeking to serve our veterans. As the Chief Veterans Health Officer, how do you see this implication of the well-being of a veteran being much more attainable or movable when you have all sectors of resources able to be matched versus strictly what happens in one entity's exam room. Over to you.
Yeah, it's a great question. I think what Dr. Mannion's outlined in terms of having the resources and the infrastructure sort of yet to be built and is being built at this time is absolutely key. The interesting thing about the concept of this sea of goodwill is that you have, this abundance of opportunities to help individuals that desperately need it. And I can tell you from my own personal experience transitioning from the active duty side of the house to the VA side and the veteran side, it was not without challenges and not without some difficulty. And I was fortunate because I had people I could lean on and ask for help. But I know that that's not the case for many of my servicemen and women when they transition. The concept about technology and how we're talking about it in this context is great, but I think we need to understand, and I think my panelists will agree, that technology alone won't save us. But technology guided by human care just might save us. And I think that's really the intent of certainly the National Hero Initiative, and that is, how do we bring to bear the stakeholders and understand and align their needs to the infrastructure that we're trying to build and create that can have them have the agency and the capacity to access the resources that they need in a more timely, effective, and efficient manner. Having said that, there are probably four things that I think AI MINDSystems Foundation as an organization, as a group of individuals, and certainly within the National Hero Initiative are sort of focused on. Of course, it's health and bridging the gap between the access to resources, whether they be physical health resources or more importantly, in many ways, mental health resources, privacy and identity. And I think Ryan can speak to that in terms of how we can use a lot of existing technology and build upon technologies that do not exist, so that privacy and identity can be actually something that is brought to the forefront in a much better and purposeful way. Machine intelligence, of course, is going to be part of the platform that underpins everything, thus AI and MINDSystems Foundation's name. And I think really importantly, and this is where a lot of our stakeholder and sort of the orchestration of this community is going to really come to bear, and that's in governance, because we have to make sure that we're being inclusive, that we're having accountability, and that we're not creating processes and technologies and things that may serve to divide instead of bring together and not widen the gulf of and the chasm that exists between, as Dr. Mannion mentioned, the veteran, the service member, and more importantly, their families, and all of these resources that are, abundant and around, but not necessarily being accessed by those that need it most.
Yeah, thank you so much. It really is staggering when we think about the impossibility of a single natural intelligence, a single human being, to become aware of, act upon, and then optimize the way potentially hundreds of categories of resources that could aid them could be accessed. That exceeds even a person with very high executive function and nothing else to do. So the implications of being able to make those resources efficiently deployed without waste, fraud, and abuse, in such a way that the humanity and the connection and the human relationships across all of these sectors, which are the heart of the need, come to the forefront, and all of the impossible, overwhelming, hyper burdensome administrivia recedes to the background. And we know that that's possible, and it's remarkable. to Ryan's earlier point about data sharing, something that sounds so simple, and it seems as if perhaps we've achieved it. When you get into the weeds in our industry, you become aware that there are security, compliance, bioethics, technical literacy, many categories of challenge that dampens our ability to get the information that is needed where it needs to be at the time it needs to be, and in a way that it can be trusted and clinically and scientifically actionable. There's a really vital role that technology can play in changing the ability to granularly consent, to authenticate, to combine with compliance wrappers that are verifiable, et cetera. And that's the ability to use a set of blockchain technologies to take different data payloads and tokenize them. This is something that Ryan has deep experience with in all of its technical details. And I'd love for you, Ryan, maybe you could use one of the scenarios that you've been most focused on around a certain category of medical image, for instance, that if it could be transmitted where it needed to be transmitted, and if it could be made to be sovereign to the person, what would that implicate? What would that look like? If you have an example from cardiology or organ transplantology, Dr. Teta might riff with you on it. Or
I'm sure there's several, but the easiest one.
Sorry to interrupt you. Or anything from the realm of neurology or traumatic brain injury. And Dr. Mannion will riff with you on that.
Well, it's if we're looking at it from a patient perspective, anybody with a neurology or any kind of cardiothoracic problem would benefit from the fact that not exactly maybe owning or having all of their health records themselves, but having access to and being the orchestrator of where they go and having the choice therein is very important, not only to them, but where the fluidity of where the records can go. I think what you'll see is like what you were alluding to, Heather, that this information may all be available and can be transferred, but then you reach all of those critical mass walls, like who has the permission to send it from hospital X to hospital Y. I think one of the most important things is to make sure that if you can collect the data in a raw form, let's take, for example, DICOM imaging and radiology. If you can transpose that into the systems that receive those easily without major fixes to those systems they already have, and just implementing and improving upon what they have, and at the patient's discretion, it not only helps the patient level of service, really, it also helps the institution avoid redundant testing. It also helps the institutions have the materials in front of them that they need right away for comparison. Addendums to medical records can be expensive and cumbersome. I know in several of my past experiences of working in ancillary offices that provide these kind of diagnostic imaging and reports and outputs, that it's so much easier if the patient has the ability to just transfer it themselves instead of going through, well, we'll ask our medical records office, and the medical records office has to go through some new protocol that perhaps this other institution wants you to follow that others don't, and may not adhere to all of the obligations that they're supposed to. So it's very important to make sure that the underlying data stays in its original form and has that data integrity, and tokenizing does that. That is one of the magical things about blockchain in healthcare that I find fascinating. I don't have any really specific stories for neurology or cardiology, but I'm sure we'll come into those as time goes forward. Yeah, they apply. I'll just tell you that they do apply.
Thanks, Ryan. I totally respect your bug for this intersection of blockchain and healthcare. At one point, I was referred to as the fairy godmother of blockchain and healthcare during a conference, which was hysterical to me and all assembled. But it's something that once the full comprehension of the implications sinks in, you can't
Mhm.
you can't
Can't
unsee
shake.
it. Yeah, you can't unsee it from that point. That happened to you, Dr. Mannion. Not on a similar timeline that it happened to me. Maybe you could give a little bit of your perspective, especially in the implications of the implications to the foundations of science and AI MINDSystems Foundation's vision for that, getting started in National Hero. And I do think the second edition of your book would be a great one to mention briefly.
Sure, certainly, yeah. And on the book, I was a co-author with a journalist on a book called "Blockchain for Medical Research: Accelerating Trust in Healthcare" that was published just as the pandemic rolled out in March of 2020. We are updating that book. It's a slow process, but we hope maybe by the fall to have the second edition out. That takes me back to, back in 2016, 2017, when I was first exploring what this array of technologies could do. And while I think, obviously the assets are exciting and there's incentivization in many different ways that can be applied. There's even a more core fundamental aspect of an audit system and an automated governance system that blockchain brings to bear that has been really lacking in not only aspects of healthcare, but in research and in the science that gives us the evidence-based medicine that we rely upon. Being able to track, like we do with our food, being able to track ingredients that are in the food that we have, or if you think of like a farm to table restaurant, having a sense of where all of these things come from is not something that we have easily with regard to evidence-based medicine. You can take a pill and you know where the ingredients for that pill came from, but you don't know all of the evidence to support the taking of that pill for certain diseases or for certain populations. Being able to better understand the type of studies that went into it, the evidence grade of the research that went into systematic reviews that go into clinical practice guidelines becomes far more possible with this technology. I did return on research investment work for the Department of Defense, looking at how to take the research that was being done, consider the attribution to eventual cost savings and health outcomes improvements down the line. But you've got a time lag of, it's on average 17 years bench to bedside. And so being able to do that is very, very difficult. There's some groups out of King's College and Rand Europe that have done it. But by and large, it doesn't get done. And so we rely too much on guesswork for our evidence-based medicine. And I think this technology allows for a much better tracking provenance of data and being able to understand what goes into the evidence-based decisions that we're relying on for our health and wellness.
Thank you so much. And before we move on from you, do you mind providing just one example of a major fraud that has occurred in science where that has then infected the downstream, through citations, through grants being built on work that was viewed as seminal? Could you speak just to that really quickly? I think an example there would be really helpful.
Yeah, there's fraud is the extreme example, but there's a lot of non-reproducible research that's out there, and that research is not very helpful. And honestly, it infects generations of science after it. Recent problems that have been uncovered with regard to Alzheimer's research pointed to the fact that it over the last 18 years, we've been making funding decisions really relying on an overweighted amount of evidence due to some fraudulent studies. Cardiac stem cells was another area area where a lot of effort went into an area of research that turned out to be fraudulent. This bad science, if you will, takes a long time to uncover, a long time to excise, and really just compounds over decades mistakes that get introduced into the system. And being able to identify those faster, being able to embargo or quarantine certain scientific topics if they need to be investigated is something that we've not really set up a good system for. Science is the best system we have for knowledge generation in the biomedical area, but it is also very slow to correct, and being able to correct it much more quickly with data provenance, with information and knowledge provenance, would be something that I think we can achieve with the right application of technology. But going back to what Dr. Teta said, it's not about the tech first. It's about the people first. It's about the ideas. It's about the appropriate governance being built into the requirements for the tech. And that application of the technology at the end of that process is what we're hoping to align.
Thanks so much, Dr. Mannion. Dr. Teta, you also were very early to the field of clinical AI, at least its modern implications in clinical AI, as Sean has been at the intersection of blockchain and science, or decentralized science, as it is often or sometimes referred to. I would love if you could share some of the history that you lived through, and where you had the opportunity to lead through uncertainty and initial creation of some incredible things at the DoD's Joint Artificial Intelligence Center. And I think there's a lot of parallels between how different exponential technologies can be brought together, as we're doing at AI MINDSystems Foundation. Over to you.
Yeah, that's a great point, Heather, and thanks for the question. I can't help but comment on Dr. Mannion's two examples very quickly, because they struck a personal nerve, and this was not by any means coordinated or orchestrated. I had no idea you were going to use these two examples, but certainly with the cardiac stem cell research that you described. I mean, that's my profession as a heart surgeon, and with a specialization in heart transplant. This is information and certainly studies we've been following for years and decades, and the impact of how some of that science has been perceived has certainly impacted our practice for sure. And then I'd be remiss if I didn't mention losing my mom in 2023 to a long bout of Alzheimer's. So again, having lived through that disease that she endured as a family member, as a caretaker, along with my sisters, and knowing how invested anyone becomes when their family member, or unfortunately themselves, get afflicted with that disease, and to know that there's been so much effort potentially put into the treatment, cure, amelioration of that disease, that may have been based on things that were not necessarily true, and then the consequent and unintended consequences of having all those resources, time and money wasted, when they could have been diverted someplace else and probably positively impact lives like my mom's and others, is really interesting. It also does call to question why I think we have this ongoing debate in society right now with respect to the trust of science, and we're sort of at this watershed moment where there's a sort of a distrust. But hopefully, as you mentioned, Dr. Mannion, the people leading, hopefully our group and others, leading with hopefully the right objectives, and then marrying technology can sort of help address this moving into the future. But Heather, your question is one that I always love to tell, in terms of the story, how I came to be in this unique position of, I guess, being exposed to AI. And it's sort of a little bit of a misnomer to say that, right? Because AI, of course, was coined back in the 1950s, well before I was born. I like to tell the story that AI has been around for decades. What has not been around for decades, and I think why people are so interested in AI and why it's certainly taking up a lot of the oxygen in our society right now, is because there's been a convergence of a number of things. computing power. I was always fond and look back with great joy about programming my Commodore 64 as an adolescent, and I love that platform. Right now, I'm carrying around a supercomputer in my pocket that would dwarf maybe hundreds, if not thousands, of those things. So that computing power, the abundant resources of investment that are being made right now in AI, certainly data, our connectivity, and really the talent of computer scientists that have built upon decades of this work that have, pioneers before us have been, dedicating careers to. I have brought about this convergence, right? And then, of course, the blossoming of ChatGPT and the large language models sort of on the public scene, and the ability for people to actually use and touch and feel AI, I think, is really what's brought the attention to it. But much like Dr. Mannion, 2016 was a very pivotal time for me, because that was when I was at the National Defense University serving not as an AI person, but simply as a command surgeon, newly indoctrinated into the subspecialty of clinical informatics, building on my thoracic and clinical work in trauma surgery. I found myself surrounded by a community of incredibly intelligent military leaders, many of whom came from the intelligence community, many of whom had been leveraging AI technologies for years and decades, analyzing information to gather intelligence. And in having those discussions with them, usually as the only physician in the group, I could not help but realize there's something eerily familiar in these conversations. We're looking at all this data. We're using these great technologies to synthesize, extract insight from that data, and make better decisions. Sounds like healthcare to me. Certainly sounds like cardiac surgery to me. And I was fortunate, due to a chance encounter with the late great General Colin Powell, to be persuaded to go to his alma mater, National War College, and be part of the class of 2018 as the only physician graduating with my august and esteemed colleagues that year. But more importantly, that institution afforded me an opportunity to do independent study, and I decided to concentrate my studies on AI in military medicine. And my thesis paper was AI in military medicine, the strategic application of the general purpose technology of our era. That paper, as most papers are that are produced by students at war colleges across the country, get archived, and sometimes many of our military leaders go back to some of those documents and look at the ideas that were generated from people that had time, space, and resources to think about very complicated problems. And in my case, I was fortunate that the attention was given to the paper, and I was recruited soon after graduating from National War College to go lead the Warfighter Health Mission portfolio at the Joint Artificial Intelligence Center, and had the opportunity to recruit an incredible team of people. And we were charged not only in our work in warfighter health, but across the entire organization, believe it or not, think about this, to get the Department of Defense interested in AI. I know it sounds laughable now, right? This is 2019, 2018, 2019 timeframe. And you think to yourself, well, how could that even be a question? How could that even be? And I know humans are very good at having amnesia about certain things that may have happened just a few years ago. Case in point, the global pandemic, for example. But nonetheless, when you look back, and I reflect as I do often, especially when I talk to my colleagues, and we look at what's happening now in the zeitgeist of AI and society and people talking about things, it's never been lost on us that we were vehemently fighting to get the attention of people to pay attention to AI in the department. And those same individuals that were a bit indifferent to it are now, on numerous panels and webinars and all across the world talking about the greatness of AI. So it's a bit interesting how things happen. But I'll give you one very early example of how consequential the time was for me, and how impactful it has been to sort of see the arc of history, this very short period of history after the AI winter, for me anyway. And that is as you can imagine, being a big department organization as we were, well capitalized with billions of dollars initially, and charged with not only leveraging AI and bringing solutions to the department across the entire department, we were wooed by all of the leaders in the AI space, the Microsofts, the IBMs, the Googles, the C3 AIs, you name the company, they all came and courted us. And we in turn courted them as well, because we realized that we could not develop any of these novel things in a vacuum. We needed the help of industry. But as we got to know what they were working on and they got to know what we were working on, we were exposed to a number of demonstrations. And I go back to 2019, where a group of my colleagues in the Warfighter Health were meeting with Microsoft engineers, and they were exposing us to some of their new technologies. And we were asked to give prompts. I'm calling them prompts, but they weren't called prompts back then, to the engineers, and they were typing things in, and we had a nice whiteboard, and you'd see these magical, words kind of come out after we were giving prompts. And I had the opportunity years later to validate that that was in fact the beginning of the new platform that Microsoft and OpenAI were working on that everyone knows about now. And to be witness to that kind of technology, that kind of novelty, years before it becomes something that's sort of in the lexicon of everyone's vocabulary now is really amazing. I mean, we got to do some incredible things and deliver some really powerful and impactful solutions to the warfighter, and deliver them at the point of care where I believe to this day, our service members and their families are better off. So that's a little bit of my spiel. Probably not as interesting as Dr. Mannion's, but 2016 seems to be an important year for both of us. So.
2016 was also the year that I got involved in the blockchain and healthcare intersection. It seemed like a pivotal moment. Dr. Teta, you actually authored a memoir and expressed your vision for the future of AI about this time that you spent in the Joint Artificial Intelligence Command. Could you tell us just a little bit about that book?
Sure. It's just like Dr. Mannion, I guess we both like to write about the experiences we've had and observed. And so, yes, you're correct. I recently wrote that book. It was published just a few months ago. You, of course, wrote the kind forward that really set the table and paints the vision for what I believe is going to happen. And whether it's AI mind system that pioneers all of these beautiful things that you outline in that forward alone or in concert with a number of people, one way or the other, it's going to happen. Because I think when people realize that they have not as much domain and dominion over their data as they should, and perhaps not necessarily recognize the value of their data right now, but once they do, have that epiphany, I think there'll be both a social and public outcry that will demand that the things that we've outlined be put in place. So your forward is very appropriate for the book. And the book's title is called Smarter Healthcare with AI. Not surprisingly, the subtitle is Harnessing Military Medicine to Revolutionize Healthcare for Everyone, Everywhere. So very deliberate in the subtitle to point out how military health care and the system in military health has been a great pioneer in contributing to how we deliver civilian care. And unbeknownst to many people, many breakthroughs in military medicine have occurred, and those breakthroughs have permeated to the civilian sector. The only good thing that comes out of war, as many of my medical colleagues like to say, is the advancement of military medicine. And the advancement of military medicine, in turn, leads to some benefit and positive societal gain for civilians. Just to name a few: vaccines, blood transfusions, trauma care, and the ability to take care of seriously ill and wounded individuals. Many of those advances in trauma have been pioneered by our colleagues in the military, and those permeate and find their way into the civilian sector. I think AI is our new one of those. And certainly if I look back at what we achieved during my time at the Jake and what's continuing to be done right now, those advances, because of the investments we had, because of the different incentives that the military obviously has as opposed to the civilian sector, are going to continue to permeate and find their way into the civilian sector. So we absolutely were leaders in applying, developing, scaling, implementing, and delivering AI solutions in the healthcare space in the military. And those are going to continue to happen, and hopefully will be great examples for the civilian sector to follow. So that book outlines that story. It provides a great anecdote and some really, I think, cool examples of the things that we did, but more importantly, I think serve as examples for what the civilian sector can learn.
Yep. Thank you so much. I love the book, and it was my great honor to offer its forward. So thank you again for that. You know, there's many things that you said that had me firing off. This reminds me of a Dr. Mannion thing, as we were talking through it. But I'm thinking about everything from cybernetics to the Society of Critical Care Medicine to just the odd parallelism of both of your roles inside the DoD. Dr. Mannion, you were a DoD civilian for much of your career. Over to you. I'm sure you have reactions.
Yeah, many of the things that Dr. Ted had described mirrored some of my own challenges and opportunities. The Department of Defense is a very interesting organization. It's simultaneously one of the most innovative organizations out there, while also sometimes getting in its own way and forgetting things that it has previously created. For a documentary on a 1979 book on AI by Pamela McCordick called Machines Who Think, I've been doing some slow dive work going through a lot of archives of some of the originators of AI and even some of the pre-AI history going back to World War II, where really cybernetics was born, and which precursored AI, which was later named in the 50s as Dr. Ted mentioned. It was DoD funding. It was for a wartime effort that a lot of the early ideas came about. I think the first conference on what became AI or became cybernetics and then spun off into AI in some other areas was actually January of 1945, and they kept no notes for it because everything was classified because it was all being done under the war effort. There's just letters between John von Neumann and Norbert Wiener that describe some of the contents of what happened there. Absolutely fascinating. Norbert Wiener himself, along with Julian Bigelow, created what was probably the first AI model for targeting planes. That it was never put into practice, but the file was kept secret until 1949. It was finally published. That also contained probably one of the first mentions of information theory that Claude Shannon also got credit for creating, but he had read that classified file back in 1943. So a lot of this stuff has DoD roots and spun into opportunity. But of course, mention of the AI winner in 1973, there was a drawdown of the funding for AI. Things got pretty bleak for a while. I like to say that Pamela McCordick's book, which was published in 1979 and tried to get DARPA funding but did not, was what got us out of that AI winner by giving a contextual sense of what AI could do. That said, I bumped up against the same forgetting what they've helped create. I was talking with DARPA in the 2017, 2018 timeframe about different blockchain opportunities, but at the same time, the DoD was not too interested at the Defense Health Agency level of getting involved with what they called block gain. At one point when I was in DoD, I was told to stop talking about that block gain, and of course I didn't, and others didn't. I was surprised at my first blockchain and healthcare conference that I went to, sitting at a table with a rather scruffy looking individual who turned out to be another Navy officer, Dr. Roger Boodoo, who at the time was doing a University of Illinois Chicago fellowship for technology, and was not in uniform when I saw him, but was still active duty. He went on to be one of the first directors innovation chairs at DHA. Brilliant guy. Also has now transitioned to civilian sector. So it's there's a lot of innovation within DoD and other parts of the government, but sometimes it takes a little while to bubble to the surface.
It's interesting. You mentioned Dr. Boodoo, who's a shared friend of three of us here on this panel, Doctors Mannion and Teta and myself. Dr. Boodoo is a radiologist, and that actually is a great segue into we've been talking about context and history and how AI MINDSystems Foundation and the National Hero Initiative is grounded in a wider view and a more multidisciplinary, interdisciplinary approach to these intersections and implementations of multiple exponential technologies. Ryan, I'd love if you could elaborate a bit on the many intersectionalities of the implications for science and medicine that are made possible not by AI alone and not by blockchain alone, but rather their technical convergence and what that opens. Over to you. You are muted, Ryan.
Sure. I think there's a little bit of debate in the larger blockchain industry about what role AI has. Is it going to be an oracle we use within blockchain? Or is it going to be how do they relate to each other? In healthcare, it comes down to the provenance, basically, is one of the most important things. But I think another important thing to remember is that it has a value. And therein lies the blockchain part to it. And that value may not necessarily, we're not talking about monetary value, but it has a different value to different stakeholders within the ecosystem. So that value for that health information and that data asset is what leads to those models that Sean was talking about earlier becoming more trustworthy and having valued and verifiable information from the start. And if those values from the blockchain assets are of a certain grade and quality, then the AI consumption of those assets can be at least elevated to a more trustworthy plateau where more investigation in the right direction can proceed. And not in the retrograde direction of going back and, hey, we have all of this wrong data. So I believe that it accelerates the research. Healthcare is commonly known for being such a slow adopter of technology, but as we're sitting here, we are, I believe, kind of on the cutting edge of what healthcare has to offer. And getting that to the market as becoming a faster reality with really just compact technology. We don't have the need for a lot of physical infrastructure anymore. There can be a lot of just regular software additions to certain programs that allow for information to be processed differently or transcribed and used in different contexts. And when it's verifiable from the start, you have a healthier ground to stand on. So I think it's very important that the two work together, and together they come up with enormous administrative and price savings for a lot of organizations that are looking for ways to increase their bottom line, really.
Thank you, Ryan. And I think I'll add to that by expressing that person-centeredness is an industry vision and a consensus position of a of a necessary evolution of our field. We all know that today, especially in the United States health system, the fundamental organization of how information systems are set up is around billable encounters and the revenue cycle. And fortunately, that is less the case in military medicine. But generally, the way that the systems are structured and data exchange was originally implemented or not was oriented around the needs of maintaining that revenue cycle. In AI MINDSystems vision, what we are creating is a different organizational structure of the complex adaptive system that is healthcare, where individual human beings, you and me and all of us, are in fact the air traffic controllers of every process that involves us. And you might say nothing about me without me. And the implication of achieving what we call data sovereignty on behalf of patients is sweeping in its implications, both in care coordination, multi-party care coordination across organizational boundaries, in a vast range of novel and emerging research modalities and structures, and critically also in the ability to differently train AI models and use them at runtime in a safe and both technically and clinically validated approach. Our perspective about clinical AI is that implementations should not ever be thought of as one and done. There is an ongoing operating model, to Dr. Tedda's points earlier about the criticality of governance. That means that as we more deeply partner natural and machine intelligences, the machine intelligences are not fixed, their outputs are not fixed, and the system as a whole is highly dynamic in many directions. This partnership between natural and machine intelligences has to have its monitoring and evaluation functions clinically, scientifically, and technically. Right now, the operating model for that doesn't exist in our industry. And AI MINDSystems, under our National Hero Initiative, we are creating that to complement all of the extraordinary work that's being done by so many teams and colleagues around the world, advancing clinical AI and advancing the capabilities of blockchain and Web3 technologies. The last topic I would love to turn to here, with giving each of you the opportunity to comment, is on the role of individual privacy and inclusion. An important point I want to raise is that if populations or individuals are underrepresented in health information, and that may be because they have no access to care, for example, then you use that information to train AI systems without any malice or with any malintent, using the only resources available to do that in the present tense. You very well may be, and in multiple cases have been shown to be, accelerating and amplifying disparities at an institutional and cultural and social level. Meanwhile, for those whose data is included in the system, there have been consistent privacy breaches, massive and continuous security breaches, and bioethical risks that are poorly managed or identified or controlled for. I would love to hear, maybe starting with you, Sean, and then we'll Dr. Mannion, we'll go to you, Dr. Tedda, and to you, Ryan. And we could also make these our closing remarks to talk about both this matter of inclusion in the system, which comes with major privacy problems, and exclusion from the system, which creates major problems with bias and an absence of generalizability for huge sections of our population that we wish to care for most urgently. Over to you, Sean, for your closing remarks with that prompt.
Well, I think one of the things that we need to be aware of, and sometimes we get excited about technology and we jump past the fact that we're really doing experimentation on its application, and that experimentation is on humans right now. And I think that making sure that we are appropriately validating its clinical value, its clinical validity, not just in a laboratory or virtual laboratory setting, but in a clinical workflow setting is critical, but doing that in the context of existing frameworks and ethics for human subjects research, I think is important. The Belmont Report, which is the foundation of the United States common rule, which governs how we do human subjects research, has 3 points: respect for persons, beneficence, and justice. And so you want to make sure that you are following those as we apply these technologies. And really, as you spoke to it, the generalizability and making sure that we're creating things that are not only useful for all people, but also not damaging to subsets of the population is absolutely critical. And with the right structure of research, with the right application of how we do research in any clinical setting for any type of clinical tool is going to be important, is going to include that consideration. Sometimes with technology, the research, the clinical research side of the house kind of gets nervous about it and doesn't understand what's going on. And then the regulatory side of the house doesn't even know that they may be the ones who need to oversee the research going on with it. And so these things move forward. And there's been, unfortunate incidents with United Health Group and others rolling out AI that just really wasn't ready to be scaled. And making sure that we're appropriately getting things right before we scale them, I think is absolutely critical.
Thank you, Sean. And quick remarks from you, Ryan, and then Dr. Tedda, I'm going to give you the last word.
Sure. As far as people being included and excluded from the system, that is a concern as far as data breaching and the like. I would say that the beauty, though, of blockchain and the systems that we're doing now is the ability to come up with better and more granular population health statistics and informatics about general population without necessarily revealing someone's character. If it's possible to have someone that is in control of their records and it isn't quite visible whose records those are or what they contain, we can maybe increase trust among participants in these healthcare systems. And like Sean said, it would be great to have that down to a trusted process first before scaling it. And it's really does quite a shame, like you said, Heather, for the bias of the information that comes out when you don't have a certain whole demographic. I remember when I was working for the IoT committee, P2933, there was a big part about wristwatches and getting blood oxygen levels for people with darker skin. And it was a real problem. Like, are we able to get all of this information? And there's the whole part of, are we able to get the information? Are people including all the information? And are we getting the information correct? So there are many processes to making sure all things line up. And I would hope that more people would trust the system to include their records for future reference.
Thanks, Ryan. And audience, Ryan's referring to the IEEE Standards Association P2319. Which is a standard that uses blockchain to register and establish trusted data transport and device identity in the Internet of Medical Things.
Clinical IoT. Yeah.
Clinical IoT, yeah. So one quick thing before I hand it to Hassan, for those of you listening in, I'd like to remind you that this is a recurring monthly live stream that will be progressively unpacking our work in healthcare and life sciences, occurring each Friday. each Friday, the third Friday of each month, forgive me. And we welcome you to the ongoing events. I will close it out after what you have to share, Dr. Teta.
Thank you, Heather, for that. Yeah, it's not been lost on me. You've said this in numerous other forums that there are large swaths of humanity, right, that have mental and physical health challenges, and yet they're not necessarily patients at all, right? They just simply have not even accessed the healthcare system. The World Bank has estimated, as you have espoused, in 2024, 1.5 billion people who've never even walked into the hallowed halls of a hospital, seen a doctor or a nurse practitioner or any healthcare professional for that matter. And so you think about those individuals having agency over themselves and, more importantly, being subjected to, as Dr. Mannion suggested, health care imposed upon them when they have never even been considered, especially when you're talking about AIs and algorithms and models and things foisted on them. It's really interesting to think about that challenge. Bill Gates, as you probably recall, they've just in the last few days had him quoted as saying that in the next few years, doctors will be replaced. Doctors and teachers will be replaced because of AI. Very bold. It's got a lot of traction. Lots of people have been asking me, do you think it's true? Do you think it's true? While I respect Bill Gates and certainly admire all that he's done, I would respectfully reframe his prediction and make it appropriate for our work here. It may not be that the doctors will be replaced, but what I think will happen is that AI will continue to amplify the very best in healthcare providers. I always tell my doctor friends that are worried about AI, you better not be worried about AI, but you should be worried about doctors that are using AI replacing the doctors that are not using AI, because that's probably what's going to happen. But more importantly, and I think that as a way to close out this this chapter of our segment here, is that I think AI is going to amplify not only the providers, but more importantly, the individuals. Those 1.5 billion people, guess what? They're all walking around with one of these, a cell phone. And that's a powerful computer in their pocket that gives them tremendous opportunity and potentially agency over a whole domain of their lives that they probably are not necessarily in charge of right now, and that's their health. So when I think about what we're doing at AI MINDSystems Foundation and the work that you're leading, Heather, with a cadre of incredibly talented people, to include our most recent person, Ryan, here, and that is designing a dynamic, privacy-protecting ecosystem, specifically for HERO with veterans and service members and first responders, but, ideally humanity at large. And like, as I mentioned, I think we all have had experiences where we were all in our careers, respectfully, trying to convince people that this thing is going to happen, whatever this thing is, whether it be blockchain, whether it be AI or whatever it is. And it took years for us to sort of see it evolve. And then now it's just kind of like, of course, and so it's not been lost on me that although we're talking a bit in some of the abstract right now, the foundation is being laid to create that platform where data serves healing, right? And individuals do maintain agency over their information and ideally their outcomes. And I think what will happen, and what is certainly destined to happen, is that as more and more people become aware of how important their data is and how their data is being used upon them, and not necessarily with their agency right now, and they get to sort of epiphany, there'll be an outcry for the very system that we are building right now, and the ecosystem we're attempting to establish and will establish in time. So thank you for the opportunity to be a part of the discussion. I'd like to think that our 2025 discussion now will be our 2016 discussion in a few years, and we'll say, yeah, 2025, we had this webinar, we're talking about all these things, and now, of course, they've magically come into existence. So thank you.
I love it. Thank you so much, Dr. Teta. for all that you do at AI MINDSystems Foundation and broadly. Thank you, Dr. Mannion, for your persistent and continuous thought leadership in the field of science generally, system sciences, all that you do. And Ryan, welcome to our team. And we're thrilled for your work to get underway in our variety of medical data tokenization scenarios. Audience, thank you so much for joining us today. We can't wait to see you next time, 1 month from now, the third Friday of April. And goodbye. Have a wonderful day.